I'm just wondering why so pessimistic, why the huge possible number of infections?
So it's a science of the disease. It's a disease to which literally no one has immunity, and the same estimates are there for the US or the UK in terms of proportion. The numbers seem high for India because we've got a big population. That said, most of these infections are mild or not even noticeable. So I think the thing to focus on is not that number, but really the focus should be on the number of severe infections, which could overwhelm the Indian health system's capacity to deal with it when it's at its peak. And that's really what's of greatest concern at this time. But I should also say that those are baseline numbers without the interventions that have now put in place. And our estimates are that this kind of a lockdown for a sustained 2-week period can knock down that number of infections by as much as 70%.
But some say the lockdown has been pretty chaotic. I mean, how effective can that be?
Well, I think the lockdown started, slightly chaotic. It was first a voluntary shutdown, a Janta curfew, which was intended to get the population on board to understand that this was something that was being done for everyone's benefit. And now it's gotten progressively stronger. I think the most important parts are really the shutdown on interstate traffic. The railways are shut, the airlines will soon be shut, and interstate bus travel is all shut, which would allow for slowing down the seeding of cases in states where there are fewer infections. So keep in mind, all of the cases in India came from outside of the country, as it did for any country outside of China. And they all mostly showed up in the west of India, where the biggest cities, New Delhi, Mumbai, fifth place in Gujarat, and then Bangalore and Kerala, and then will move progressively east. So that's the dynamics we're trying to slow down, as well as the dynamics within each state, and hence the extreme lockdown, which is already happening in many places.
And Ramanan, you mentioned the 300 to 500 million estimate. What sort of timeline are we looking at now for a country that is so densely populated, and in terms of medically, they're poorly equipped? Is this a sort of a trajectory that you're seeing that's similar to Italy, for example, or the US or other parts of Europe?
It's actually hard to know. There are other variables at play here. India is a young country relative to Italy, therefore, the proportion of the population that's elderly is actually lower. So you might see herd immunity sufficiently amongst the young that prevents, as dire a situation as what happened in Italy. But we're also seeing in the literature coming out of China that children are affected. There's a lot of unknowns about how this is going to play out in India, and we could end up doing better than these countries in terms of on a per capita basis, but things could be just as bad. And the honest truth is nobody really knows at this point.
And you mentioned India is different than many countries. We were just talking to our colleague in Mumbai about the informal workforce, where they make up half of the GDP. These are migrant workers, street vendors that make maybe $2 a day. And they don't have the luxury of social distancing or access to health care. Is the government doing enough for the poor right now, or do you think the impact to them is going to be worse than what we saw during the demonetization?
Well, let's just say the impact of the entire country is going to be quite dramatic. But the focus right now by the government is not on the economy per se. It's really on making sure that people don't die. And I think that's appropriate. Public health has to take precedence at this point in time. I think as the weeks roll on, there has been a finance task force that has been set up under the finance ministry to essentially look at ameliorating some of the adverse impact on everyone, the farmers, day laborers. You're talking about, hundreds of millions of people, and everything in India gets amplified by a few extra zeros compared to other countries. So I think there's some hard work in the days, weeks, and months and years ahead, to be quite honest.
You talk about amplification. This is a country so large with a lot of rural areas. How about in terms of healthcare accessibility? I mean, can the rural areas access healthcare?
No, that is really a concern. Critical care, which will be needed, or even things like oxygen cylinders, typically are not widespread outside of capitals, state capitals, and to some extent they're available in district capitals. But there's now a serious effort to figure out how to get this kind of equipment into the places that are projected to be the most affected. So this is nothing short of war in the sense of the mobilization that the country is going through, and the work that's going into it. There are industrial groups like the Mahindras who've said they'll make ventilators in response to people telling them, look, we don't have enough ventilators in the country, or the government is trying to procure ICU beds, and here again there's a role for people to try to step in to make these. But at the peak of infections, we are vastly under-resourced in terms of human capacity as well as actual bed capacity to be able to solve the problem. But the other side is that India is gearing up for it. And I don't think anyone is under the illusion that the lockdown alone is sufficient. The lockdown will cut down the number of infections at the peak, but we will still have a peak of some sort. And I think everyone's gearing up for that as well.
Ramanan, you're an epidemiologist. You're also an economist as well. Can you help us quantify the hit that this coronavirus can't have on India, which is already struggling to really bounce back from these 11-year lows when it comes to growth?
Honestly, I'm not a macroeconomist, so I shouldn't take any sort of crack at a question like this. But let me just say that there's aggregate economic growth, which is largely driven by, corporates and things like that. But there's also the large component of our economic growth, which is from rural India. And honestly, my deep concern is that rural India, where infections are already seeded because of migrant workers going back from their cities because there's no jobs, and you've probably seen pictures of them or videos of millions getting on whatever transport they could to try to go back to their villages in UP, Bihar, or wherever else it is. And I think rural India will take a big hit and will need a lot of help to come back. I think that the corporate sector and the IT sector, they can work from home, or they will probably bounce back a lot faster. And some of the hit to India will also come from the fact that it's the rest of the world. If everyone is taking a hit, then India will be no different, as I'm sure is the case in every single country. And I think